Wagwan everybody, welcome to Cali Medic. Today we're going to talk about gestational diabetes, also known as GDM. Please like and subscribe to the channel and hit that notification bell so you can be notified of more informative videos. So what name gestational diabetes? Gestational diabetes is a high blood sugar we develop during your pregnancy. It usually goes away after your baby born. It can happen at any stage of your pregnancy, but more common in your second and your third trimester. During your pregnancy, your placenta makes hormone that causes glucose to build up in your body. Your pancreas used to send out enough insulin to handle it, but in this case, your body not make enough insulin, or your body just not use the insulin how it's supposed to. So the blood sugar level go up and you get gestational diabetes. Gestational diabetes can cause problems for you and your baby during pregnancy and even after you have the baby. But you can reduce all the risk if you find out early and manage it well. So who more likely to get gestational diabetes? Any woman can develop gestational diabetes during their pregnancy, but you're at an increased risk if you're black. Yes, being black is a risk of getting gestational diabetes. You can also get it if you're overweight or if you did have one baby who weigh more than 10 pounds. If your mother or your father, brother or your sister have diabetes, that make you more likely to get gestational diabetes too. If you did have it before, you're more likely to have it again. And if you're over the age of 25, that also puts you at risk. So what are the symptoms for gestational diabetes? You don't normally have no symptoms at all for gestational diabetes. You normally find out when your doctor or your midwife do your glucose tolerance test, what them normally do when you're pregnant. Some women develop symptoms if them blood sugar get too high. Symptoms like dry mouth, tiredness, you're more thirsty than usual, and you want pee-pee every minute. Some of them symptoms are common throughout anybody's pregnancy and don't necessarily means that you have gestational diabetes. So if you're in doubt, get it checked out. How gestational diabetes can affect your pregnancy? Most women with gestational diabetes have a normal pregnancy and a very healthy baby. But in some cases, it can cause problems such as premature birth. That's when you have your baby before you reach 37 weeks. It can cause preeclampsia, which is another dangerous condition, because if you have high blood pressure during your pregnancy, and can cause a lot of complications if it's not treated. It can also cause polyhydramnios, which is when you have too much water around the baby. This can cause if you have premature labor or problem when it's time to deliver your baby. With gestational diabetes, your baby might grow bigger than usual, and this sometimes can cause difficulty during delivery. So this increases your chances of having an induction of labor or a cesarean section. After the baby born, the baby might develop low blood sugar or jaundice and might have to stay in hospital to get treatment. If you have gestational diabetes during your pregnancy, it means that you're more likely to have type 2 diabetes after you give birth to your baby. And it also means that you can lose your baby before you even give birth to your baby. So it's important, if you have it, you manage it well. So how you manage gestational diabetes? You have to monitor and control the blood sugar levels. You have to get a blood sugar testing kit, and you use that for test your blood sugar first thing in the morning before you eat anything, and then you do it again 1 hour after you have your breakfast, your lunch and your dinner. Your midwife or your doctor will show you how to do the blood test properly, and then will tell you what levels you should be aiming for. When you have gestational diabetes, you have to watch what you eat. If you never have a healthy diet before, you have to try your best to start have one now. Make sure you're having 3 meals a day. Eat plenty fruits and vegetables and avoid sugary food. If you're unsure about what you can eat, go check a dietitian. They will give you advice and help you if you plan healthy meals. Physical activity lower your blood glucose level, so regular exercise can be an effective way to manage gestational diabetes. Regular exercise and a healthy diet can keep your blood sugar levels under control. If your sugar levels is well controlled with just diet and exercise, there is no need to start on any form of diabetic medication. If diet and exercise can control the blood sugar level, then the doctor will put you on medication. They might start you off on the tablet, but the tablet might cause if you have side effects. Side effects like being sick, stomach cramps, diarrhea, or you can even lose your appetite. If this is the case, then they might consider giving you insulin, which is the injection that you use. They might also start you on the insulin injection if the tablet alone can't control the blood sugar, or if your baby is too big, or if you have too much fluid surrounding the baby. The insulin injection can cause your blood sugar to fall too low, and if this happens, you start feeling shaky, sweaty, hungry, you start turn pale, or you find it difficult to concentrate. So if this ever happened to you, you need to treat that right away. To treat this, you have to have yourself a sugary drink, or a snack with high in sugar. Try and eat some food as well, and have some more sugary drink, just to stabilize your blood sugar levels. When you have gestational diabetes, you have to monitor your pregnancy. When you go see a midwife, she's going to measure your belly. And your belly is supposed to measure to the same amount of weeks you are. So if you're 30 weeks, your belly is supposed to measure 30 centimeters. But in some cases, it can be 2 centimeters below or 2 centimeters above. You might also need to have regular ultrasound scan throughout your pregnancy, just to monitor the baby growth and the water with the baby. After the baby born, try and feed the baby within half an hour so that the baby blood sugar not go low. And after that first feed, try and feed every 2 to 3 hours to stabilize the baby blood sugar level. The midwife will go check your baby blood sugar before the second feed and a couple more times after that, just to make sure so the baby blood sugar levels are right and the baby no need to be admitted in the neonatal unit. 6 to 13 weeks after the baby born, you should do a blood test to find out if you have diabetes. If the test come back normal, then repeat the test every year because you're now at risk for having type 2 diabetes.